From the Toronto Star, I'm Adrian Cheung, and this matters. Even though Toronto remains in lockdown, there are many people who have to go into their workplace, who work essential jobs. So, how would you feel if you went into work and found out that 68 of your coworkers tested positive for COVID? Would you consider that an outbreak at work? That exact scenario played out in January at one of the biggest construction sites in Canada. But the answer from public health and the companies involved on why this wasn't originally reported as an outbreak was anything but clear.
Toronto Public Health is implementing a system to share specific information about workplace outbreaks without compromising individual privacy.
So what counts as an outbreak? Shouldn't you know when and where it's happening? On This Matters, we're talking to Rosa Saba, business reporter for the Toronto Star, who looked into the details of the big outbreak and what we should be learning about how COVID is spreading in our workplaces. Hey, Rosa, thanks for making the time to talk.
Thanks for speaking with me.
Your reporting on workplace outbreaks, it began with a very simple question, a question I think many people are asking, which is what counts as a workplace outbreak? Where did asking that question lead you?
This actually started a little earlier with that, I would say. It actually started with one specific potential outbreak, which was the Well. We received a few tips about the Well, which is a large construction site in downtown Toronto. You can't miss it. Obviously, the question, first of all, was whether or not there had been an outbreak at the Well, right? How many cases? Was it an official workplace outbreak? We had to answer that. But what I didn't realize at the time when I started looking into those tips was how complicated it was going to be to get an answer to that question. So I tried going a few different routes. I asked Toronto Public Health, I asked the Ministry of Labor, and I asked the two companies in charge of the site, multiple buildings and two general contractors. But at the time, Toronto Public Health wouldn't say. So all it told me when I asked, has there been an outbreak? How many cases? They told me they were only publicly naming businesses with significant outbreaks. Only one of the companies in charge of the site would tell me how many cases it had had. So we initially reported that number, which was 15. It wasn't until the Friday evening, a day after we reported 15 cases, that the Ministry of Labor confirmed there had been 68 cases within 1 month.
The location that you're talking about is the Well, which is the largest development project in Canada. For people in Toronto, it is at the corner of Front and Spadina. They recorded 68 positive infections over the course of a month. That has to be considered a workplace outbreak, right?
That's what I thought, right? And this is honestly a little bit ironic, but part of the reason that we ended up doing a second article about the Well, but also about workplace outbreaks overall, is because when I was reporting on those 68 cases, the spokesperson for one of the companies actually made a point of telling me that Toronto Public Health had not deemed their cases as an official workplace outbreak as per the definition. And I thought that was interesting because, I looked up the definition and I kind of thought, well, 68 cases, I find that a little hard to believe, to be honest. I asked the other company, they said the same thing. And so, you know what? I decided to look into it and see if there was another story there. And up until last Wednesday afternoon, Toronto Public Health was still giving me the same line about only publicly reporting significant outbreaks. So I didn't have any way to fact check that. But at the last minute on Wednesday, they confirmed that the site did have an outbreak as per the official definition.
There's 68 cases here over the course of a month. So how do they square those two things and along with that, I should also add the word that you use, significant. What does significant actually mean if not 68 cases? So how does Toronto Public Health square that with the actual numbers?
Right. So I will preface this by saying that I don't have answers to all of this, but I will start with the specific definition for a workplace outbreak. So as you mentioned, the official definition, which is, available on the Toronto Public Health website, available on Ontario's website, 2 or more confirmed cases in the workplace within a 14-day period where both cases could have reasonably become infected while at the workplace. There's a little bit of wiggle room there, but, basically, as long as we know they didn't get it from their grandma at Christmas, for example, right? That's that's an outbreak. As for significant, I don't think it's ever been clear what that means. So up until this week, actually, Toronto Public Health was reporting all outbreaks by number, but only naming businesses with significant outbreaks. Their metrics for that decision weren't available to me, but it likely had to do with the perceived risk to the public. But that's going to change soon. And I do think that's for the better, because really, significant is such a broad term, and we really didn't know what they were basing that on.
So what is that change in protocol of reporting? What will Toronto Public Health do now that before they weren't doing?
So on January 18th, the Toronto Board of Health requested that the names of all workplaces with COVID-19 outbreaks be publicly posted on a weekly basis instead of just those with outbreaks deemed significant. That's supposed to start this week.
In going into the details of this, it had to be a bit frustrating for you as a reporter, because from the outside, at least, I think to a lot of people listening in, this almost feels like confusing wordplay or semantics of drawing the line of, well, what counts as an outbreak and what doesn't, and what the time period is. For most people, they just want to know, okay, have there been a number of people at this workplace that have tested positive? That's all people really want to know. So just figuring out the details of all of this has to have been even confusing for you as a reporter.
Absolutely. I mean, that confusion was what I tried to illustrate in the second article, was that the question of whether or not there had been an outbreak seemed like a simple one to me as someone who hasn't actually reported a lot on workplace outbreaks before this. And it ended up being a really complicated one. Again, in all fairness, everything is changing this week, and I think for the better. I was speaking to an epidemiologist for another story on construction sites, and he said the same thing. The fact that they're going to now report all workplace outbreaks by name, regardless of their quote unquote significance, that's a good step, because we're no longer relying on them to sort of parse what's considered significant and what's not. We're avoiding that confusion. And in the interest of transparency, I think it's a lot better to just have all those names out in the public and avoid these kinds of situations in the future.
We'll be right back. Construction is one of those things that has been listed as an essential workplace, an essential business. You're looking into that too. What do we know about positive cases and infections at construction sites, like at the Well?
Well, one of the epidemiologists I interviewed for my last article on the Well did mention that the sector group that includes construction has had some of the higher numbers when it comes to active workplace outbreaks.
More than a dozen workers at this construction site at Michael Garron Hospital have tested positive for COVID-19, but the site will not be shut down. Ellis Dawn, the company that runs the site, says Toronto Public Health is satisfied with the safety measures in place here, but workers tell us they are dealing with unsanitary conditions.
Unfortunately, that group includes other sectors as well, so it's kind of hard to get an exact number, but it is clear that, there are transmissions going on at construction sites. And I'm working on a story now looking into reports I've heard from construction workers across Toronto and in Ontario talking about COVID precautions on sites. There's a bit of a workplace culture issue on some sites when it comes to wearing masks and that kind of thing, and there are concerns about how well those rules are being enforced. So I'm going to be looking into that. But I will add as well that some companies are kind of starting to really take enforcement into their own hands. I actually just heard from Ellis Dawn, one of the contractors at the Well and at a number of other large sites in Toronto, that they're going to start implementing rapid testing at a number of sites. So the idea is rapid testing, you get a response within 15 minutes, and they're hoping that that's going to provide a lot more data and hopefully prevent things like what happened at the Well. So things are changing, but it is certainly, I think that added transparency is also kind of making it more clear that we need things like rapid testing at these large sites where people from various trades are coming and going, and there's a lot of work where people can't social distance, right? So it's definitely been interesting to look into, and that story will be up soon.
Many people, like Toronto Mayor John Tory, have used some of the words that you were just describing there of public accountability. and transparency about disclosing workplace outbreaks.
This is also why public health will now be publicly reporting these outbreaks. I believe this kind of transparency and public accountability will help to encourage employers to do everything they can to protect their workers, and it will help give everyone a better indication of where the COVID-19 virus is spreading in our community.
Because that's important on a number of levels. We, as the public, need to know where it's happening. We need to know how to properly trace it. In digging into these details, what do you think that this case, and it is just one case of workplace outbreaks among many in this province, what does this one case, do you think, tell us about transparency around workplace outbreaks?
I think it tells us that, while some definitions or metrics or what have you may seem very absolute, the moment that there's any room for interpretation, that's when transparency starts to get lost, I guess, is what I'm trying to say. For example, significant, the word significant could really mean a lot of things. How are we supposed to know what a significant outbreak means, right? And I think that really illustrates that even though the definition of a workplace outbreak was fairly clear, in my opinion, what constituted a significant outbreak was much less clear. And I think that was further illustrated by the fact that that's going to change, right? I think somewhere along the line, someone realized that wasn't actually as transparent as it could have been. And I think that whenever there's that wiggle room, that ability for interpretation by a body that, we don't have access to that decision making, that's where transparency was lacking. That
in some of the wording of things, that it becomes a little hazy in how people apply to it and what they will perhaps publicly admit or report, at least. Yeah. And again, in all fairness, I think this pandemic has been full of instances where we launch a program or where we launch some kind of initiative and then we realize it's not enough, right? Lots of programs where the eligibility has changed after the fact because we realized there were people falling through the cracks. And I think in this case, what was, initially launched as a data source, as a way of reporting on workplace outbreaks, was found to not be as transparent as we hoped it would be. And luckily that's going to change. You mentioned earlier rapid testing as one of the ways to fight workplace outbreaks and to get a better handle on this thing. This is a really complicated subject where, there is no silver bullet. Epidemiologists always tell us there's not one thing that solves this. So there's rapid testing at workplaces. Some advocates, some small businesses, even the City of Toronto has said paid sick leave is a really good idea from the federal and provincial government. Does the reporting of outbreaks, is that a crucial part of it too? Did you learn that in the reporting of this story? Yeah, absolutely. I think at the very core of it, the public has a right to know where significant outbreaks are happening, right? Especially because, we're in the middle of a lockdown, or maybe not, hopefully near the end of a lockdown, but, where a lot of businesses have been shut down, but a number of others have been told they're essential. And there has been a lot of confusion and frustration over what's considered essential, right? And presumably these decisions are made based on data, but we don't always have that data. And I think it shows that when we have the data that these decisions are made on as much as possible, that, increases public trust, or at the very least increases accountability so we can hold those decisions to account, right? We can say, well, here's the data and here's how this decision either does or doesn't match up to the available evidence. And I think that's why one of the reasons that transparency is so important is, these huge life-changing decisions are being made by government bodies, and we need to know why they're being made. Rosa, thank you so much for your reporting and for your time talking to us. Thank you as well. And that is Rosa Saba, business reporter for the Toronto Star. Rosa has more reporting on COVID and its effect on the construction industry this week. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Mutar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.